And we do that. All right. Welcome, everyone. Thank you for being here in our last week of the 2026 ARCA Virtual Learning Institute. We've had a month full of really great presentations, wonderful topics. Today's presentation is Ethical Decision Making in Counselor Education, a justice-oriented perspective for sociopolitically challenging times. Our presenters today are Dr. Allison Levine and Dr. Vilia Tarvydas, and we thank you so much for being here. Both come in from Iowa. Dr. Levine has been with the Department of Counselor Education since 2021 in Iowa, and dare I say in her bio, it's nationally ranked clinical rehabilitation counseling program. She is a rehabilitation counselor, nationally certified counselor, and a temporarily licensed mental health counselor in Iowa. As a counselor educator, Dr. Levine has expertise in teaching culturally competent practice, multicultural and social justice counseling competencies, and disability justice informed counseling practice at master's and doctoral level. She conducts social justice-oriented research, examining disability biases in helping professions, equitable student assessment and counselor education, and systemic barriers to post-secondary success for transition age youth with disabilities. She is with ARCA, and we're so proud of her in her role, has done incredible work in the research and knowledge area, has really elevated that. And Dr. Levine incorporates advocacy in her research, teaching, and service, seeking to understand difference, inform policy, and improve counseling services for individuals with disabilities and mental health disorders. And Dr. Vilia Tarvydas is Professor Emerita, former chair of the Rehabilitation and Counselor Education Department at the University of Iowa, and founding director of the Institute of Disability and Rehabilitation Ethics, IDARE. Vilia has served as president of NCRE, ARCA, and the American Association of State Counseling Boards. In the latter capacity, she is a member of ACA and part of the 2020 Initiative Oversight Committee. She completed a 5-year term as a board of directors with CACREP in 2019 and served as its vice chair during that time. She is well renowned for her work in ethics and ethics models. And I could continue reading, but I think you'd much rather hear from our speakers today. Just as a reminder, we ask that you keep your mics on mute, questions in the chat, and we are recording. And with that, presenters, I turn the floor over to you.
Thanks so much, Christine. I know Dr. Tarvydas and I are very pleased to be here. And fun fact, even though we've both been at Iowa, we have never. Vilia was not the chair when I got here, so we only know each other because I ended up working here. But I'm very excited to be able to. The little baby doc student Allison could not even fathom being able to do a national presentation with the Vilia Tarvydas. So I'm very excited to have this opportunity. And yeah, we'll get started in a little bit after we go over the learning objectives. As questions come up, please throw them into the chat. We're happy to answer them in real time. I think that'll probably respond better to the way the presentation is set up. And yeah, so without further ado, we'll get kicked off here. So thanks for joining us today. We're going to talk about ethical decision-making in counselor education, a justice-oriented perspective of socio-politically challenging times. We are all living in challenging times to work in higher education and to exist as people who want to help people, and particularly as people who are supporting communities who are historically marginalized. And so in that capacity, we are regularly, as of late, being inundated with a lot of news, a lot of rhetoric, a lot of reactions, and a lot of legislation that makes it challenging to do the work that we all do. And so for today, our goal is to cover these things. Hopefully you'll learn these things and many more. We'll see how it goes. But to participants will understand the use of ethical decision-making models for counselor educators. We'll discuss common ethical dilemmas in counselor education. We'll apply the Tarvydas integrated decision-making model, there's a typo, through the lens of applied participatory ethics to current ethical dilemmas in counselor ed. And then we'll analyze the impact of the socio-political landscape on ethical dilemmas in counselor education programs. Those two are flipped. So we, have a tall order today and not a tremendous amount of time, but we appreciate you all joining us, and we will get started. So, as I said before, we are in a socio-political climate that is unfriendly to the institution to higher education institutions and more broadly speaking, public education. And so depending on the state you're in, that probably looks and feels differently. So some of this may be more relevant to you than other parts, but generally speaking, we're seeing, policies and practices affecting higher education in substantial ways. It's not to say it hasn't happened in the past, but what we're seeing now is obviously stressful, to say the least, and somewhat concerning, more than somewhat. So counseling and education as professions are inherently political, ideologically, and practically. So I want to start here because oftentimes in our fields, we hear people coming to our fields who say they don't want to be political, they just want to help people. We hear that often. I hear that often personally. And we, need to, as a profession, come together and recognize that the work that we do is inherently political. And what I mean by that is, number one, as you all hopefully are very well aware, we were created by federal legislation. And so that's just straight out the gate. The politics of that time had to exist in a particular way to make vocational rehabilitation possible, right? To say that, oh, these disabled veterans deserve the opportunity to work. And so we're going to create a program so that they are able to do that when they return to civilian life. And so that's if we even just don't consider anything else, we were simply created in this way, right? And so political factors were involved there. And then as we move forward, thinking about in education, in counseling, particularly in rehabilitation counseling, we do this work because we believe, right? Number one, in the value of every person, and number two, in the fact that people can change and grow. And those two things are actually political beliefs, right? To believe that somebody can change and adapt and grow is something that is very much tied to understanding the politics of your time, the resources available, and philosophically, if people have the resources that they need, we as rehabilitation counselors believe that they should have a right to competitive integrated employment, successful post-secondary outcomes, and all of the other things that we are constantly working for in the field and training our students to do. So just to start there, and sometimes that, I can get off on a little soapbox here, but I think it's really important because I hear, everything else we say from this point forward won't matter if you don't understand that everything that we are doing is tied in some form or fashion to the socio-political climate of our times, whether it's right now in 2026, whether it was, back in, 1978, or in the future in 2052, right? Like no matter what, the politics of that time are going to affect our specific profession and the work that we do and that we're able to do. Currently, go ahead.
At some point, I'd like to add a broader perspective to
Go right ahead.
to the list. Um, I have spent a long time looking at the nature of professionalization, especially as an old sociology major from the sociology of professions. And everything you're saying is just spot on. And I like the fact that we're actually going back to our roots and recognizing that counseling is inherently a political situation. But in terms of the sociology of the professions, one of the things we miss is the context of professions in general. They go through a cycle, and counseling is now, as many professions are, experiencing some real challenges. Rocco Catone and I used to talk a lot about pre-professionalization, professionalization, and deprofessionalization. And you look at the broader factors in the society, look at journalism as a profession. Even medicine has lost its preeminent ability to practice as independently as it would like to because of the rise of institutional practice and insurance encumbrances. So everything you're talking about is ramped up and is all important for us to talk about. But I'm also here to tell you that these are natural cycles. And so what we're talking about is recognizing that. We're in a deprofessionalization phase, as many professions are, where pressures are on us to decrease our autonomy, to make us more economically manageable. Maybe deprofessionalizing us means we become an occupation. We don't have unions and we don't have codes of ethics that will allow us to say this is not the way we should work. There's also this general distrust of expertise in science that's part of the picture. So I could talk more about that, but it feels to us as if it's a new challenge, but it is not. Many professions go through these cycles and they're related to what societal forces act upon us. So we have to be aware of how to manipulate those societal forces and not just respond from internally concerning ourselves with our internal mechanics. So that would be what I'd like to say. Just be mindful of this. And the code of ethics has always been one of the major hallmarks of being a profession. So practicing from that ethical perspective and finding out how to use it in this politically charged time is a higher skill we must practice lest we lose more ground.
Yeah, I think that's an excellent segue here into, these factors that are affecting us in our institutions, with increased scrutiny, fear of retaliation, feeling like your institution maybe doesn't support you, or feeling, that academic freedom is maybe not as solidly available to you as you maybe previously had thought. Uncertainty, across all of our, different responsibility areas. And, thinking about what that code of ethics means to us while we're also undergoing these pressures is really important. And acting ethically and using that code of ethics in the things that we do is something that will help us to, further secure our identity as a profession, right? And try and, really push back against some of these things. Because if we're all doing it together, and using them at the institutional level, then that's a true message, right? Than just being reactive. So some of the common ethical dilemmas that are happening right now for folks, and feel free to jump in if yours looks different than this, but what we, and some of these, these aren't ethical dilemmas that are new to counselor education, right? Like, or education or higher education. But in the current landscape, feel, I think, magnified in some form or fashion. They feel riskier perhaps than they had previously. So curriculum decisions, what words we use when we're describing curriculum, how we, put things into the learning objectives in our syllabi, especially if you work at a public institution and not a private institution. If your syllabi are required to be made publicly available to everyone on a website or things like that. Then, as always, a huge ethical concern for us is student evaluation, gatekeeping, and remediation. And so, in a news climate where we see educators, attacked for trying to do gatekeeping or trying to evaluate students in alignment with the values and judgments of that course, in within context, which makes sense. And then having whole careers ruined because somebody got put on the news for grading someone more harshly. Then those things are really a big struggle. I'll tell you, I struggle with that for sure. Advocacy versus policies. So we, as public employees, many of us, or private employees, we represent our institutions, and our ability to advocate and what that feels like and what feels possible in light of existing policies can be very difficult. And then, of course, academic freedom and professional risk. And I'll talk more about that in a second. I know Dr. Tarvydas has some comments on that one as well. And then just simply the existence of power, privilege, and oppression in education. If you're here, if you've heard me speak before, this is a common thing I talk about in counselor education. A lot of us like to pretend that we don't work in inherently oppressive institutions, right? But we work in institutions that were created by and for a particular group of people, who are not most people who are served by institutions of higher education these days. And so, thinking about what these institutions represent, what the norms are, what the things that we are perpetuating in our roles, and what we can do about it to better support our students, is something that also can be an ethical dilemma for folks. And so something, as Dr. Tarvydas and I were reviewing what we were going to talk about today, that came up with this academic freedom and professional risk bullet was, where is ethical risk-taking happening? And so, thinking about these different ethical dilemmas and what we're all doing in the context of our jobs, and in, especially working with students, developing course content, making selections about what's going to be public facing about our jobs. What are we doing and how are we taking risk? And who are the people who are taking risk? So when we think about ethical risk taking, right, like there's an ethical dilemma that preempts, I think, ethical risk taking. You kind of experience the dilemma and then maybe make a choice to take risk. But things, in this climate feel risky, and perhaps more risky than some of you have experienced in your careers previously. And so this concept sort of came up as something we're going to continue to come back to, but just keeping in mind, like, what does that mean for you? Where do you see it? Where do you want to see it? Those are all things that I think we could all benefit from sort of reflecting on more. And Dr. Tarvydas, I think you had something else on this.
As you said, I'm imagining we'll return to this whole idea of ethical risk-taking. I spent a lot of time doing ethics grievance and disciplinary work, and through that, I talked to a lot of people that were facing, even back in the day, maybe different in a different context, but major risk. Or what we used, and sometimes decisions were made about whistleblowing. So let's unpack that question about ethical risk taking a bit. It's not a yes or no question. There's an assessment process. There are tools. There are decisions to be made before one really launches into that. So I'm going to mention a few, and I'm hoping we return to a couple of them later. First of all, the main thing we're going to be talking about soon are ethical decision-making perspectives or models. One of your best assets is to make sure you've thought this through carefully and that you truly know what not only the ethical but the viable options are, that you have completely gathered the facts, that you've sensitized yourself. We call it situational awareness in the military, to a variety of things. So if you've done, whether it's my model or any other good, really solid decision-making process, it's an asset. You won't go off half-cocked saying, oh, never mind, I didn't realize this, or overlook assets that you might have that you can bring. And that is the other question I want to raise, and I want us to think on this throughout our time. What are our assets in terms of sharing risk? Who should be sharing risk? And how do we engage these parties in sharing the risk? My whole early history in the profession was very much hierarchical with ethics and risk-taking practice. You were the individual autonomous practitioner. You did what you did to analyze it, and then it was all on you to decide, then to take the risk and deal with it. That's not a healthy model, and that's not what my decision-making models ended up doing. You have to have partners. You have to understand your assets. You have to work on your assets and mobilize them and understand them and what they can do. You also have to understand barriers in risk taking. So in your risk analysis, you have really your ethical decision making model, if you've done it well, will help you. But we broaden it out. Institutions have to share some of the risk. AAUP, for instance, is one thing we need to mobilize and try to work with. Our professional organizations and our leadership within these professional organizations need to be mobilized and begin to give us guidance and precedent to work with. Our credentialing bodies, we have to know what their history is, how they've acted on certain types of issues and topics. We have to know the case law. We have to understand these things as potential assets and understanding what kind of risk. And then we even have to involve sometimes our professional insurance companies in understanding what kinds of risks are underwritten and what are not, and why. I mean, what are the things that are being told to us there? For instance, I'll give you one quick example that I think everybody can latch onto, and we can move on. One of the earliest things that surprised some people when I started talking about this kind of approaches, talking to insurance companies about things like having sex with your client. If you ever read the policies, they're not going to underwrite that risk, right? No matter what you do, what the conditions are, what you might say about it, overdone through, we don't touch it. So that is not a risk that is underwritten for good reason. It is resoundingly in case law as well as in ethical codes not permitted. So there's much to be learned about unpacking risk taking, what our partners are, and what we can glean from that kind of an analysis. So that's my kind of starting salvo, because we are feeling like we're in a risky environment. I want us to understand that it's not a yes, no, that there are assets, there are processes that will help us.
Thank you. I would not have thought about that with insurance policies.
Well, you do this long enough and you find out some interesting things.
So ethical decision making in counselor education. Part of the reason I wanted to do this presentation was, we all teach about ethics, right? It's like it's really should be in every course that we're teaching, and we should all be very familiar with the codes of ethics. And yet ethical decision making in and of itself, I think, is something that isn't robustly done in practice. And then in counselor education, as I started to reflect on sort of how I make decisions, and especially in light of a very, challenging couple of years with the legislation and policy changes in our state as well as federally, I started thinking about this, because we are always telling each other, we're talking to each other regularly about our codes of ethics. But then when it comes down to like the brass tacks, so to speak, like when we're actually making the decision, are we going through an ethical decision making like actual process? And so, even just thinking about myself made me think like we probably as a group need better conversation around this. So we know ethical codes guide our practice, right? Like we have a lot of criteria around what educators are ethically obligated to do, what we need to look for in our students. And I think as with a lot of the social justice work I do, a lot of what I notice is it's an outward facing evaluation, right? It's very much I'm assessing my students, I'm thinking about what they're doing, and I'm teaching them what to do. And we're not always looking inside, right? We're not always being reflective and particularly when it's difficult, or it feels like it would take a lot of time, or it feels like, well, I know that person is going to give me an answer I don't want, and so I'm not going to go through the process of consulting them. Right, that happens in institutions of higher education, in departments where there are many people and often feel like there are too many cooks in the kitchen. In higher education, there's also oftentimes what feel to be very rigid and inflexible policies that just demand compliance and don't really make room for the gray stuff that comes up in counseling and ethical conversations, right? Like it feels like you're trying to merge two things together that really aren't made to go together, because there's this one, on the one hand, like, well, I need to keep my job, right? I need to do this thing. And in this time where a student could be recording me at any moment, where I could go viral on Fox News for saying something in class, right? Like well, ethically, I know my students need this content to be ethically practicing counselors. It's my obligation to ensure that they have this content, that I have done my best to teach it, right? And sometimes those two things feel impossible. It feels like there's a big bridge to get these two things together. But I think, our ethical decision making in institutions in higher education can be, advanced in this way, which hopefully we will tell you about, and guided by, this concept of ethical risk taking, as well as coming back to, at all times, to whom is this ethical obligation owed, right? Who are we being ethical for? Is it for ourselves? Is it for our students? Is it for our clients or their clients, technically, right? Is it for the institutions? And I think for each decision that probably is going to change in some form or fashion. But again, coming back to what Vilia said at the beginning about us as a profession and thinking about the fact that we are a part of a profession, and one of the things that makes a profession is an ethical code, is a code that we are all following, that no matter what institution I'm at in the United States or even internationally that's teaching rehabilitation counseling, the ethics should be the same. And the people practicing under the title of a rehabilitation counselor should be upholding the same code of ethics. And so coming back to some of the basics for educators sometimes is necessary for us to be able to move forward and actually be leaders, as we're intended to be. So now Dr. Tarvydas can talk about.
Oh, now they're scared.
I couldn't hope to actually talk about the model you created with you on the call. So by all means, have at it.
Okay. Well, here's what I'm going to say. Don't get scared. We're not going to go through this bit by bit, because we're trying to make sense of something in the broadest sense, so that then later on, when you look at the parts that are related to it, hopefully in another type of a training where you can really get into it, you'll understand why it is the way it is. First of all, this model did not drop out of the sky, nor did it emerge from an intense review of the literature. When I was working clinically, I was working with traumatic brain injury in a variety of contexts. I had been very well prepared and studied ethics, as it was traditionally taught at the time. So a TBI practice is like a clearinghouse for every possible medical, ethical, legal problem that could possibly arise. So I eagerly went back to the literature to see what I could find, and I found very little that could help me. We would get into things and it would talk about how to use the code, and if you found it in the code, then you could do this. It did not help me with the practical problems. So over time, I used a basic model, and I added to it as things arose in my actual practice with lawyers, with my interdisciplinary team, with the families and the persons with disabilities. And I broke it down into this 4-stage model with different components. It's almost like a checklist. You've got the main ideas in the stages, and then you've got the checklist of things you would do within that. Embedded in this, which is not I wish we had the visual. I didn't think of it till later, but is my hierarchical model. And a lot of what I was struggling with that was not covered in traditional ways of teaching ethics or thinking about ethics had to do with the context of your practice. Institutionally, within the team, what the lawyers are saying, what are the family members of the person who's your client, or in that setting I was working, patient, going to say or do as you process this. There were many errors. So, what you see here is almost a laundry list of my ethical failures and writing a rule or a piece into the model that helped. And one of the big themes that emerged way early on is we have to understand the context. So let me quickly say that right now, I think in our socio-political environment, we are very much needing to take a look at what these kinds of contexts are, because that's where our biggest problems are. We may think that this is quite different from anything we've experienced, but in essence, it's been present, especially in working with people with disabilities and other people who are disenfranchised in our society. We've had to be aware of these contexts. So my hierarchical model, which we take a look at in stage 2 and 3, is actually like a soup can sitting on a dinner plate. At the bottom level, the most basic foundation of the professional world, which has 4 levels, is our clinical counseling level, the counselor-client relationship, or in the case of an educator, the student educator relationship. Then at the next level is the interdisciplinary level, not just the people sitting around a table. We don't do that anymore, but people that might Zoom in or communicate electronically over an issue and are part of the process of working with this person. Then it gets more interesting as we go higher in this soup can. You have then the next level up, the third level is the institutional or the agency component. This is where the university sits for an educator. This is where, for me, the CEO of the hospital would sit as I was working in the rehab unit. They have policies, they have procedures, they have budgets, they have other constituencies that play into the pressures on them that then come down to us, and we have to understand that. That also includes their representatives in the institution, your supervisors, the chair of your department, your dean, etc. These are all part of that third level going up the soup can. And then at the top, we have our societal resource or public policy level. And that's where in some states you now have sort of draconian rules that are being imposed on universities that are being worked through in terms of how do they work with academic freedom, how do they work within this context, but we are experiencing those effects as educators. So just a quick skim through, I want to say 2 things. If you don't take anything away from this, you need to think more nimbly and more deeply about the roles of these different levels and how they affect you and how you can affect them as you go through a decision-making process. And this model embeds them. That's there's detail here, but there's useful detail here. So if you look at the stage, the first stage of the model, and I'm just going to give you a brief description, that's really an important stage in the sense of interpreting a situation. It's the getting to know you phase. It's situational awareness. So you have to stop, take a breath, and really let go of your panic, let go of your anger, let go of your drive to be just, and start really getting into the reality of what's going on here. Sensitivity and awareness of all of the factors, how everybody's being affected, how you're affected, how your student is affected, how future clients might be affected. Then determining the major stakeholders and their ethical claims. Stakeholders don't all have ethical claims. They might have a financial stake, they might have a policy stake, but do they have an ethical claim on you? an obligation you owe them because you are a professional with this code of ethics. The most obvious one is the main claim is always to the client. However, there could be other lesser claims or shared claims that might be to the client's parent or guardian in an academic institution, to your fellow counselor educators who are trying to work within the same curriculum, etc. So just because someone's a stakeholder and you analyze what's their stake and what pressure, you don't have to give them primacy in their ethical claims. And that's the first place the context comes in, the idea of these hierarchical model contexts. You have to think about who might all be interested in and how might they be thinking about, at least initially, what's going on here, and may they be an asset to you. Then you go into stage 2, which is what pretty much everybody thinks is ethical decision making, period, just that one stage. Look at the problem, look at the code, look at the laws, think about courses of action. And I added consulting with supervisors and other knowledgeable professionals. That's in the code, but people don't often do it. Sometimes they feel they don't have time. Sometimes they're embarrassed about what's going on here that needs to be addressed. Sometimes there are other factors. I won't go into too much rabbit hole here. But this is important because on a practical level, your supervisor A could be an asset. Even if not, there's nothing they hate worse than being surprised by a situation all the way up the line. So doesn't mean you have to approach them with the sky is falling. You may approach them with a potential set of solutions and cause and effect and what might be pros and cons. Then you decide, the best ethical course of action. It may not be the best action that you take ultimately. Then you go to 3. This is the complicated one. This is where the context, this is where the inclusion of a variety of these factors happens at the hierarchical level. You really have to reflect on what might be pulling you aside. Maybe you're driven by a sense of justice and you really feel like you've got to tackle this and you've got to do this no matter what happens. Well, look at what the harms might be. Are you enamored of that? Are you being driven by non-moral values like the need for prestige, the need to be looking like a hero? Do you have personal blind spots that you're pursuing, or prejudices? I've run into cases where people have pursued justice and then they talked to the client and the client did not want to do this. They were outed through talking about their problem with others, through getting it renowned. That client got pulled off in another direction, or the client wanted to advocate for themselves at first and try something, and lo and behold, it worked. Or maybe the student who's recalcitrant needed to have some personal counseling over something else, and then later on things looked differently, but we moved too quickly. We pushed it into a corner. Not saying these things work all the time, but you don't want to overlook a more consultative, involving decision. So at the end of that 3rd stage, you select the preferred course, given all the pros and cons and failings of different solutions. Sometimes the absolute textbook ethical thing is not the best way. The most ethical thing that's still ethical and possible that you could actually accomplish may be what you're going to end up with there. And then finally is stage 4 in where you plan. And you plan by looking at that hierarchical model and your assets and barriers at each level. You may have a very strong student who has shown growth in other ways, but not in the area that you're trying to address. So maybe that's an asset for you. Or maybe there's a mentor that could be pulled in with that person's permission, or if it's appropriate in the setting. And then the barriers. Is there anything you can do to work with the barriers and lessen their effect? And as you see, you go through that, then you put this course into action. You may have to execute it and change it as you go, and then of course carry it out and document it. So in the world of socio-political threat and context and the and the participatory perspective, we have important things that happen in stage one, where you're looking at developing that sense of involvement. Sometimes the fact-finding process, we overlook the client. Who's the best source of information, or the student that we may engage, or people in the student's realm, their advisor, their with permission, their therapist. And then, of course, in stage three, there's major concern over involvement of the individual client, over understanding context from that perspective. So I see we've advanced the slide to the next
Well,
model.
I felt like it was what you were getting to some of the participatory stuff, and I thought this was very relevant to what you were saying. So I thought it was a perfect like bridge,
It is,
because
and we
you started talking about the power and control already.
yes, we did, didn't we? I did. Here's what I want to say. This is a model that is often misunderstood. You notice that it says orientation. This is not the participatory ethical perspective is, as a rehab professional, I was practicing in a medical setting very often. And that's about as hierarchical as things get. As we know in rehabilitation counseling, we have an entire history and tradition of effective understanding, as well as work with, including persons with disabilities, our clients, in the process. And it was shocking to me at first, and then I go, duh, that we were not including clients and or patients and their families in the sense of what I was used to in rehab settings. It got me thinking, nothing about us without us. In the history of ethics, it has very often been thought in the early years, and still in some professions, that the profession owns the ethics and conducts the ethical process. And if you consult it with anyone else outside of that, it's a kind of a gift. Well, that's not the way I thought about it. The best solutions I ever saw was where we involved the persons involved with the process of deciding early on, and not before we've made a decision. Talking with them about what's really going on, what's motivating them, what are they experiencing, what are their perspectives on a good solution, what would they like to see happen in this. And doesn't mean we go off and do what that person would do. As you know, you're experienced rehab professionals, but that could be part of a solution. It could be a solution that they would buy into. It could be something that works better because included an asset we didn't know, like a supportive parent or a therapist for a student that has been working on these issues. So this is not a set of new steps to a model. This is kind of like teaching micro counseling skills to someone who's going to do therapy. In my way of thinking, the model is the therapy, and these are the overall micro counseling skills that you should be applying throughout the model. You have a restrictive orientation, which kind of describes to you how traditional ethics are still practiced or had been practiced. Unequal power, the professional owns it. The sense of who's doing it is it's very private with the professional, and you can kind of read down the list of things that happen here. In my way of thinking about it, the participatory orientation, and again, orientation, it almost is second nature to you if you start thinking about this, to start involving the client or the student early on in the process. Input from that client or student would be maximal, and it should be driven by the student or client and the counselor together as a team, as a partnership. You balance between rules and attention to the subjective process. There's a little bit of the ethics of care in here because you're dealing with the relationship, because therapeutic alliance with your student can maybe address some problems and get things moving better than if we just address it from this is right and this is wrong. The sense of the process is not that it's private and you're the professional, this or the educator that has the power. This is a collaborative, more public, transparent process. Your actions are proactive. You try to anticipate and engage before something gets to the point of no return. And you can go again down the list. So these orientations should inform who you are as an ethical practitioner and give you ideas of what you can do to maybe get a better result and mobilize some of these contextual resources and understand that your student or client or patient might have some very important insights, some reactions that you would benefit from understanding and in mobilizing. And so I'll stop there and let Allison decide whether we need to go on. But there are, certainly ways in which this does not define things, and it does bring you into a better consideration of the disenfranchised person. And sometimes in counselor educator and student interactions, we have to take into account the idea that the student is the lesser in power, and we need to be a little more concerned maybe about engaging the client in some of the ways suggested through this model.
Yeah, I think this table, I think I reference it not infrequently, to be honest, because a lot in higher education, although we've, really moved in a lot of ways to like this sort of customer service model with students, they oftentimes, and particularly if they have multiply marginalized identities, they are in a position where they are not in power. And even if they are, of dominant identities, and it feels like you're not in power as the educator because they could record you or this, that, and the other thing. We still need to think about, like, at the end of the day, we are the gatekeepers. We do have a sense of power. And by leveling the playing field with them, bringing them into the fold, we're more likely to have a positive outcome for us and them than if we just go from this restrictive top-down orientation. And the only other thing I wanted to just draw attention to in this table that I think about often is this conceptions of harm and the comparison between the restrictive and the participatory orientation. In the interest of time, I won't talk extensively about it, but I think, you hear or internalize often that only some people do these really bad things, and they are this unique few that are different, and we are not them. And frankly, that mindset, I think, perpetuates harm in a lot of ways. I think, harm is possible. I like this phrase, like latent potential. Like, we all have the potential to hurt someone. And particularly, like, I'm a white woman, right? I'm a cis white woman. To the average eye, I look like a straight person, right? And like, I have a lot of privilege in most spaces. So I have harmed somebody, I'm sure of it. Intentionally, not unintentionally or otherwise. Not intentionally, I don't harm people intentionally most of the time. But it is the potential for all of us to do harm, and we need to, I think, to really adopt a participatory orientation, you really need to recognize that and acknowledge that within yourself, which is also like an inherent part of like social justice practice. So just to touch on that part.
Yeah, I just pick up on that for a moment.
Yeah.
One thing that comes out of that you were describing is unintentionally, by short-circuiting dialogue that may go against our prevailing direction in values or in ethical principles that we might be talking about in the classroom, and shutting down discussion. We may get what we want in the moment, but are we doing harm? The idea of academic freedom for the student and learning to experiencing how to be properly critical. Critical thinking is important. So we may unintentionally harm critical thinking or a sense of developing a sense of dependency of our students on us if we don't manage some of these issues in the way you're describing. We have to think more broadly than just solving a problem in the moment that might seem to be simple, but is not necessarily that simple. It's like keeping a client on your caseload too long because they're doing well, but then we may unintentionally create a sense of dependency or helplessness.
Mm-hmm.
So, thinking about it along those lines in terms of our students and how we manage difficult conversations with them and how we manage difficult issues with them, we may get what we want, but have we unintentionally created a harm through, as you say, using our privilege in certain ways and not expanding their capabilities? So, just taking it
And
into context.
And I think a visual of that is this visual model. And we're not going to, I want to make sure we get to the case really quickly. So I'm not going to spend too much time here. But I think the visual representation of what you just said, Vilia, is this, right? As we go through these different stages from input through product, and where we have the potential to, create an inclusive experience for knowledge collection, a strong therapeutic relationship with our students, right? It's important, we're not their therapists, but we can have a successful alliance between a counselor educator and a student. Client involvement, the output is active here. We want our student, like we are training them to be professionals. And yes, right now, these days, critical thinking skills seem to be at a premium. It's very difficult to challenge every single TikTok piece of information that a student gets, right? But part of our responsibility as educators is to help them to develop the skills that we think they don't have. So I think this client involvement piece is a huge part of it. If we reconceptualize that as student involvement, that helps them to build those skills that maybe we don't see them having, or maybe we identify that they have a need. And then finally, of course, we're counselors. We want the outcome to be empowerment. We want people to feel empowered as a result of perhaps a process that on the outside or on the surface seems like it would be negative, like a remediation plan, right? The best case scenario after a remediation with a student is that they see the thing that was wrong or problematic or whatever the case may be. They see value in the experiences that they had to remediate that problem, and that they have come out the other side as a more successful, more ethical future professional, right? That's the best case scenario. That's not often how it goes. We have to sometimes drag them kicking and screaming into it, or a lot of other processes. But that's the best case scenario. And the participatory orientation to those processes really has the potential to make a strong difference for students. So we're moving from individual decision making, or what feels like maybe not individual decision making, because rarely at the instructor level is the decision being made. We have to vet it through the chain of command sometimes, depending on what we're going to do. So we are moving from this very unilateral expert-centered decision, we're making a decision in the vacuum, to a collective responsibility shared with our students. We center marginalized voices whenever possible, particularly, again, if we're working with marginalized students. We're attending to the power differential. We're trying to bring that down to make them feel like an active member of the process and not just somebody subject to, remediation and retention plans, and to, continually reflect on the process. It shouldn't be the same every time. It shouldn't be, this is exactly what another student did, and so I'm going to do the exact same process for this next student. I'm not going to involve them because this other one worked successfully. No two students are the same as no two clients are the same, right? We would teach our students that same lesson. So really moving our way of thinking about these decision-making processes to be more inclusive, more adapted based on the needs of the situation, the context, as Vilia mentioned, and our professional responsibilities as an educator. I have a quick case study. We're not going to have a tremendous amount of time. I don't think Christine's just going to shut me out here, but I'm going to I'm going to try to talk through it quickly. So this is probably relatable to many of you. This is based in reality. As part of a class discussion on cultural competence, you facilitate a dialogue about working with LGBTQ plus clients. One student challenges the inclusion of LGBTQ plus affirming counseling practices in the curriculum, arguing that such content conflicts with their personal values. This student has clashed with their peers on similar topics and has a history of taking complaints to social media. Moreover, the student has an accommodation which allows them to record class sessions. Additional relevant context, the professor of this class identifies as a lesbian. More additional context is that this is not the only class in which this student has made other similar types of comments, right? So this is probably not that surprising for many people. This is probably something you or a peer has experienced if you're in counselor education, right? And how do we move through a more participatory orientation in light of our ethical decision-making model? And again, in the interest of time, I'm going to go more quickly through this. But when we're, I've put some questions here so that these slides can also be a reference for people as you maybe experience a similar situation yourself. So as we're interpreting the situation, right, I provided some additional context, like my own reaction, your own reaction. What might that student's reaction be if they, get called into your office for a meeting? How do we get information? What information do we have, right? It's one thing for an educator to witness the situation themselves. It's another thing to hear it secondhand from another student or a TA, right? And in institutional policies, that's also a relevant factor that we need to consider. So as we're interpreting the situation, as Vilia spoke extensively about, regarding the context, we also want to get the context directly from the student involved, right? We're in that input phase. We want every piece of information from all parties. Did they misunderstand something? Were they misunderstood? Did they feel like they were, feeling defensive because another student said something that maybe clashed with their values, right? What are all the pieces of the puzzle that we need to make a defensible, ethical, and ultimately successful plan of action. So as we're formulating that ethical decision, right, like a new student may not be fully privy to what the codes of ethics say about these types of things and how resolute we might be about some things are a hard yes and some things are a hard no, right? And we have organizational policy, white papers, we have materials for days that we can provide students for information on situations such as this one, right? I made one that was, very clearly black and white for us for the purposes of an example. I know some of them are more gray and not all the professional organizations have all the resources, but we do have a lot. Our professional organizations from CRC to MBCC as our credentialing organizations to ACA and ARCA as our member organizations, we have a lot of white papers, a lot of statements that you as a professional can rely on and share with your students as you involve them in some of these conversations. As we formulate, we need to know what's relevant, what considerations we need to make, what does our administrator say, which is sometimes the worst part about this process, and what does the student say? Right? What does the student say if you start brainstorming ethical decisions or possibilities as a person who's going to be subject to the remediation potentially? How do they feel about that? Selecting an action. Are you able to remain objective? I can tell you in some of these, I personally can't. I struggle. I need to consult a lot. It's a really hard time to be a member of a marginalized community who is freely and openly hated. And that's not just, being a queer person, that's being a Black person, being a Jewish person, being a Palestinian person, being an Israeli person. Like there are so many groups right now that there's so much value in vitriol in our social media posts. And, there's groups of people who are thriving on that hate and allowing it to be present in not only our educational institutions, but when our students leave our walls that are also, steeped in this. So are you truly able to remain objective? Not that objectivity is the, ultimate goal, but really considering what's happening for you as you're selecting an action. Are there pressures that could pull you away from your preferred course of action, right? Like, what is the socio-political landscape? In this scenario, this student has the right to record the class material. So you're in a situation where you have to really consider, well, if I do the thing that I think is the most ethical, this may set off another thing that might happen. And that's something that I need consultation about with my institution and the people who support me, as well as talking to the student about it. Again, if the student is a part of the experience in this participatory orientation, we need to have meetings with them. We need to talk to them about it. What if I do this? Will you do this? What does that mean for your career? What does that mean for my career? Here are all the factors at play. And then finally, planning and executing the action. So how would you communicate this to a client or a student in a way that honors your relationship, to try and salvage perhaps a relationship or create one where there wasn't one? How do you document things so that it is legal and ethical and all the pieces of the puzzle that it needs to be, so that also you can use that to reflect and think about what you might do differently. How might you have reacted in a way that wasn't your best self, and how could you do different going forward? And so I'm going to stop talking there. I see somebody has a question in the chat. And then Vilia, if you have any final thoughts.
Okay.
We have the question in the chat regarding one-party recording being legal. And Cindy asks, how will they're moving up as I'm trying to read. How will that affect the ethical boundaries in the future for clinicians? It would seem single-party states clinicians could also record the session without being a problem, since seldom is that recording allowed in a legal setting, but is allowed for individual purposes.
Well, that's a question about legality. Let me note that first. Ethically, I think you also need to be asking the same question. And this is not new, especially for counselor educators. The idea that there might be recording, the only concern is informed consent and making sure everyone knows that they are recorded from the ethics standpoint. I shouldn't say only, I'm making it sound oversimplified because we don't have time. But I just wanted to call attention to the idea that there may be a different legal answer than there is a ethical answer, but AI is an enormously important topic for us. And this is just one of the aspects of AI we haven't addressed. AI is also potentially helpful to us as counselors or counselor educators if we use it properly for note keeping. And so I'll just leave it at that.
Yeah, I think there's a lot to unpack with that. And I think a lot of clinicians are recording sessions now because of the AI, the use of AI for note taking. And that obviously depends on the state, what happens and what's legal or not. But I would agree it, in theory, is a problem and a solution, right? AI is a helpful note taker for a lot of people, but there's a lot of complication around what happens to that recording, where does it go, where is it stored, who's using it, how is AI using clients' data to grow and learn and things like that, which is a little bit outside of the scope of what we're talking about today. But I'll tell you what, when I moved to Iowa, I didn't know there was such thing as a single-sided recording thing. I was like, oh, this will never happen to us here because it's not legal to record people that they don't know about. Spoiler alert, I learned that it is, and I didn't know that. So that's, something that's important to know about your region that you are in. And so I just want to leave with these final sort of takeaways about remaining values driven during challenging times. It's hard out there. It's exhausting to do this work and to do it diligently and daily. And so, just centering ourselves on these different things, like our personal and professional values and, acting from a place of being values driven, and seeing that as a strength and not a weakness, as sometimes it can be presented as, balancing our personal integrity with our cultural humility, right? So thinking about what do I need to know? Just because, like, for example, I'm a member of a marginalized community, but I'm not a member of every marginalized community. So I don't know everything about what it means to be somebody who doesn't look like me, or who doesn't love like me, or who doesn't um, have spiritual values like me, right? Like, I don't know those things. And so we always need to keep our cultural humility in check and not assume what we know for one is the same for all. If we're working with disabled clients, which we all are, and we're teaching students how to work with disabled clients, every single person we're working with is going to have an intersectional identity. And what that looks like is going to be different for all of them. So we need to make that apparent to our students, as well as being aware that there will be, things we don't know and things we can't see, which should be something that helps us to reconceptualize how we're thinking about our own ethical risk taking, right? Coming back to this, where we started, what are my identities that allow me to be, taking more risk? Like, I recently just found out as of July 1st, I'll have tenure, right? And so that unfortunately for Dr. Estrada Hernandez, that means I will be taking more risks and will be, able to use my voice in ways that I probably still was before, but with with less fear than I did, which is necessary. It's necessary to protect our profession and the clients that are served by our profession. And for me, in my personal beliefs, to act with integrity. Balancing advocacy with self-care, recognizing cultural taxation is real. The people who do the most labor around these topics are the people with the most marginalized identities, who are historically the most disenfranchised by institutions of higher education. And so if you have the space and the capacity and you have privileged identities, really, doing that advocacy work, supporting your colleagues who, are doing it maybe more loudly, and helping everybody in your department and in your, collegial setting to balance that advocacy with self-care, and working together in that endeavor. And then being a part of community, creating a community that is values driven, creating it so that, like, to act outside of the norm in a way that is highly unethical is across the board going to be something that's looked at like, right. And having that community that you can consult with, that you can, go to the group chat and find out what somebody else thinks or how somebody else is experiencing what you're experiencing, and using that as a space for consultation as well. Engaging people you maybe don't usually talk to find out, how would you think about this? In this particular scenario I gave earlier, I go to CrossFit, and at my gym, there's one of the youth Christian group leaders is a member of my gym. And I pulled him aside after one of the workouts and I was like, hey, can I talk to you about this? Because I don't know how to engage with this student. I don't know how to talk to her. Like, I feel like she already, like, my stuff is coming up, right? And I don't understand her stuff enough. And, like, we just had a great, off the cuff conversation about this that helped me in addressing the situation. And he offered to talk to more of my students if I needed him to. And so it was really helpful. And for me, like, also, like, just a check of, like, well, not everybody from this group feels, negatively about my group, right? Like, he very much came from a place of, like, this is what it means to be a member of my community. And so it was just a really nice experience to have. So now I've talked more than I intended to, and I apologize. But thank you all for joining us today. Thank you, Vilia, for your time and your expertise. Really appreciate it. And I'll turn it over to you if you have any other closing statements.
I don't, but I do want to thank you for bringing up this important topic, because I think it's our responsibility as scholars and leaders to help provide dialogue, reflective concern, so that we can prevent moral injury of our counselor educators and so that we can stay on track. But I just want to reassure you that while this is a very difficult time, this is not a new time. We have served a clientele. We are probably, of many counselor groups, most expert in helping people navigate a powerless situation. And so we can use the models and understandings that we have, I think, to bring us to the other side. But we also have to recognize we have to broaden our context out. Our profession, our society has got to be challenged to accept some of their responsibilities here. So that community and consultation is broader than we think.
And I'd like to take an opportunity to thank you both for sharing this provocative topic. Um, really gets the wheels spinning, and the comments in the chat have been just that, very appreciative and gives folks a lot to think about. So thank you so much for being here, and thank you participants for being part of this. Again, we have 2 more presentations this week and hope to see you there. Take care and be well all.